It's really great to be back here. This is my third year at the World Heart Summit. It's always a fantastic event with engaging speakers and a really, really lively audience with lots of time for questions and answers. So don't let me down. We want to hear your questions. It's important for you to be heard as well as hearing our fantastic speakers. So as Christina says, this is a really important topic, the opening plenary on cardiovascular disease and environmental change. As she says, we know that it's linked with diseases. We think primarily of respiratory, we think about heat-related, extreme heat-related diseases, but actually there's a big impact on cardiovascular health from air pollution, and we're really only beginning to get to the grips of knowing just how big it is. Now, today, the World Heart Federation is launching the World Heart Report. It's already got a huge amount of interest with headlines in the Financial Times, in Forbes, and more to come. So that's how important it is, and I'm really delighted that we have the report's author to come to talk about it. Dr. Mark Miller, I wonder if you wanted to come to the stage. Dr. Miller is a reader in air pollution and health at the Centre for Cardiovascular Science at the University of Edinburgh, and chair of the World Heart Federation Air Pollution and Climate Change expert group, so welcome to you. His research investigates how air pollution affects health, specialising in the biological mechanisms by which inhaled particles impair cardiovascular function. Joining Dr. Miller on the panel is Professor Prabhakaran Doiraj, World Heart Federation board member and also Executive Director of the Centre for Chronic Disease Control in New Delhi, by background a cardiologist and renowned researcher. To welcome to you. And I'm also delighted to welcome Dr. Maria Nera, extremely experienced in this area, currently Director of Environment, Climate Change and Health at the World Health Organization, where she's been since 2005. So there'll be a short amount of time at the end for your questions, so do think of your questions along the way. But with no further ado, I'd like to welcome Dr. Miller to the podium to present his findings. Thank you, Mark.
Thank you. Well, good morning, everyone. It's a pleasure to see you all again. It's also my third year here as well, and I'm starting to see some familiar faces who I look forward to seeing every year. Thank you very much for having the opportunity to present the World Heart Report. This is the second World Heart Report, and the focus is on air pollution. Now, we may be asking why air pollution. Over the course of the next 2 days, we're going to hear a range of really important topics, and any of these topics could have been the subject of the World Heart Report. We also have ministers of health, distinguished ministers of health, I think, in the audience, or maybe not in the audience. I think they're being held out back, ready to be set loose on you in the next session. And they may be asking, well, why should I care about air pollution? We have economic crisis, we have poverties, we have pandemics. Why air pollution? So here's my sales pitch. So air pollution affects everybody. Now, we think about air pollution, we think about people with respiratory disease, we think it affects people with other types of disease and the elderly. But let me make this clear, air pollution affects absolutely everyone. It doesn't matter if you're young or you're old, you're healthy or you're sick. It affects you throughout your whole life course, even in your mother's womb. 95% of the world's population breathes dirty air. This is air above air quality guidelines. But also, really, there's no safe level of air pollution. So this number really should be 100% of people. And since I mentioned economy as well, I'm not going to cite the figures because the figures vary hugely, but make no doubt about it, air pollution is associated with a huge toll on both death and illness, and it has a huge economic burden. Now, one of the real trends in air pollution these days is we're now seeing effects well beyond the lung. And this has really now come to the stage where we're seeing effects in every single organ of the body. But if we really want to focus on where those key concerns are, I would say that the cardiovascular effects of air pollution are most prominent, and this is what I'm going to discuss today. Before I do that, though, let me just present you a little bit of background here. We think of air pollution, and it's often discussed as a single entity, but it's not. It's a complicated mixture of hundreds of thousands of different chemicals. They come from a wide range of sources, some of them man-made, some of them natural. And because of this, there's some unique fonts. Because of this, air pollution is a very complicated substance. As I say, hundreds of thousands of chemicals, we tend to group them together in particles, liquids, and gases. And within each of these categories, there's many different chemicals. Many of them have the capacity to harm health. I'm going to focus really just on one category today, and that's the particles, and a subset of these particles that we refer to as PM2.5, fine particulate matter. So these are particles with a diameter of less than 2.5 micrometers. That's about a 40th of a width of a human hair, so certainly invisible to the eye. And what we have done for the World Heart Report is we have taken the most recent World Health Organization data, because this data is very robust. It's based on, as well as satellite data, ground monitoring data, and this probably is the more robust data. We're using 2019 data that I'm going to report today. And to do this, we're going to look at the trends in particulate matter and the burden that is associated with it. So let's start with the trends here. Now, there was a conception that air pollution is decreasing, and it is. That is the good news. Worldwide, and that's the black line in the middle there, air pollution has decreased over the last 10 years. However, the decrease is small. We've got a 1% reduction over the last 10 years. This is very, very low. There are positives, though. We are seeing a reduction. Many countries are doing quite well. The Europe region and the Americas have made big strides, but we have to bear in mind that in some countries, air pollution is increasing. There's huge variability, there's huge regional differences, and certainly the low and middle income countries have a disproportionately high exposure to air pollution. And these levels are increasing beyond what are already very, very high levels. In some countries, the levels of PM2.5 are 10 times the World Health Organization guidelines. How does this affect health? So let me start with mortality here. And here's perhaps some good news. We are decreasing air pollution slowly. The mortality rates attributed to air pollution are decreasing in all regions of the world. That's good news. What we have to bear in mind, though, is that the population, the world population, is growing. Our population is becoming older. And actually, if you look at the actual number of deaths attributed to air pollution, they are on the rise. Now, this is the graph in the middle is showing total mortality. And this pie chart, I want to break down this mortality into different causes. And we're focusing just on the cardiorespiratory mortality. And there's 5 different sections there. Of those 5 different sections, we have ischemic heart disease and stroke. They make up 70% of the mortality attributed to air pollution. Now, I don't want to dismiss the lung effects of air pollution. They are very important, have a huge impact on health. But when we're talking about the death that's linked to air pollution, cardiovascular disease is where we should be looking. So let me focus on this a little bit more. So focusing just on ischemic heart disease and stroke, again, we have good news. Just like the mortality as well, the rates attributed to air pollution are on the decrease. But the actual numbers still are on the increase. And this is really where I want to highlight the key figures of the report here. And that is based on the 2019 figures, PM2.5 alone is associated with 1.9 million premature deaths from ischemic heart disease, almost 1 million deaths from stroke. These are staggering figures, so I've talked about them a lot over the last few days, but it still surprises me. Remember, this is year on, year out, millions of deaths due to air pollution solely from cardiovascular disease. But this still is an oversimplification. There are many different air pollutants, many different cardiovascular diseases. I've told you about 1 air pollutant, 2 cardiovascular diseases. Within the analysis that we did as the report, we focused on meta-analysis of various different cardiovascular diseases, other air pollutants as well. And I won't ask you to read these bar plots. I've shown them because they're so lovely. But the main message is many different air pollutants are robustly associated with many different cardiovascular diseases. This is the meta-analysis. If you go down to the individual studies and you say what cardiovascular diseases are linked to air pollution, well, we have a long list. This is just a few of them. Pretty much air pollution is associated with every single cardiovascular disease you can think of. And unfortunately, this is rather depressing. I presented these staggering statistics, but those statistics will be huge underestimates of the true burden that is linked to air pollution. I've been talking mostly about ambient air pollution, outdoor air pollution as well. It's important we also consider indoor air pollution. There are indoor sources of air pollution, and these have been studied for many years. The focus is on solid fuel burning, And this is particularly prevalent in lower middle income countries. So this is essentially a graph of the world looking at solid fuel use. We can see countries, for example, in sub-Saharan Africa, that really rely on the burning of wood and biomass. And this creates high levels of particles and gases that we know are harmful to health in the house. And similarly to outdoor air pollution, we now have further deaths. So indoor air pollution or household air pollution is associated with 1 million cases of ischemic heart disease, 1 million deaths from ischemic heart disease every year, 700,000 strokes every year. And this is on top of outdoor air pollution. Again, we're seeing the health inequalities here. So you can see from the map the regional differences. If we group these together in high, middle, and low-income countries, you can see that really the low-income countries really face the greatest burden of heart disease due to indoor air pollution. I should mention, though, you'll see the line there in the high-income countries that looks like it's at the bottom there. This is a growing area that you'll see now, and you may see some of the articles coming out in the press. We need not to be complacent in our modern houses. When we look about the indoor air pollution in modern countries, we measure it in a different way. There are many sources of air pollution indoors. And as we move to net zero, we are almost making our homes more airtight. These indoor air pollutions build up. So you can expect in this space, we hear a lot more about these health effects. I'm just going to very quickly go this. I'm sure I'm getting close to over time now. I just want to quickly just scan on the last few slides, talk about what else is in the World Heart Report. We look at air pollution interactions. We look at, for example, the relationship with climate change and air pollution. They are not the same thing. They are the brother and sister. There's similarities, but there's many differences. We look at the interaction between other forms of air pollution, with smoking, with other cardiovascular risk factors, diabetes, hypertension, with pregnancy. We look at behavioral factors, physical activity, therapies, diets, and supplements. I highlight these because I know these are of interest to the various World Heart Organization, the World Heart Federation expert groups. They're also important to policy. We also looked at policies here. We looked at guideline levels, and essentially the take-home message is we need more committed action. For example, less than 10 countries meet the World Health Organization guidelines for PM 2.5. And even more concerning, less than 64% of the countries in the world have legally binding powers and policies on outdoor air pollution. There are positives, though. We highlight case studies where we have cities around the world who have made changes to air pollution, and hopefully the health effects will follow by changing city design, urban spaces, transport. Well, let me get towards the end of the talk. It's important that I focus on some of the key recommendations. And we have highlighted 9 in the report. I think it was about 25 when I first wrote them, and they were quickly edited out. Let me focus on just the key 5 presentations. The first 2 are the most important. Countries really need to be adopting the World Health Organization guidelines for air pollution. These were updated in 2021. These measures are very stringent. Make no doubt about it, many countries will struggle to meet some of these guidelines, but there are interim targets. We encourage governments to make a roadmap to meet these, and these are important targets. They are based on the health. We encourage governments to support fossil fuel non-proliferation treaties. We are at a stage now where we know combustion of fossil fuels generates some of the most harmful air pollutants. In addition to that, we need to look at some of the inequalities. We need to improve inequalities both in monitoring of air pollution. We need to improve the modelling, and the health effects will follow. This is especially true in low and middle income countries. The Clean Air Fund highlighted the need for better funding for air pollution research and also the technical innovation. And if I can finish, probably, even though I'm talking about, we do need more research into the cardiovascular effects of air pollution. Air pollution is changing, new air pollutants are emerging, and the cardiovascular effects and understanding them will be crucial to that. One last slide. I know that I've cheered you all up this morning. I can see the happy faces. Air pollution is an insidious and a ubiquitous exposure that has staggering effects on life. But we need to bear in mind that air pollution is a preventable risk factor. We know some of the solutions, and there are opportunities here. If we can effectively reduce air pollution, the health benefits will follow, and we can see the great cardiovascular benefits in health if we can effectively reduce it. And I will largely stop there, other than just to thank the writing group. This is not my report. This was a team report, a huge team. Can I really thank the writing group? What a wonderful group of people to work with. I would like to think of them as friends now, although I don't think they think the same about me. But thank you, everyone involved. Thank you all for listening.
Thank you, Mark. Spot on time there. And as you can see, here it is, the World Heart Report. Very good reading. So you can read that at your leisure later. But we are going to have an hour conversation with our panel about it. I mean, what I took from it was that, as you say, the huge staggering figures. When you talked about the figures for indoor air pollution, household pollution, and you said these are on top of the outdoor ones. I thought they were going to be within that. So, yeah, huge. But before I come back to you, Mark, I just want to get some immediate reactions from our panel here. Dr. Neera, what did you make of that? It is, as Mark says, sobering reading. What were your initial thoughts?
I'm trying to refrain and not use my Spanish body language because I'm extremely happy. I mean, you cannot imagine, we have been for years at WHO promoting this public health issue, saying we need to take more action, and one of the most important actions for us is exactly what we are doing here today, putting these two communities together, the non-communicable diseases, I mean the cardiovascular health for everyone, and air pollution. So the fact that you are joining this fight and with this powerful, of course I endorse 100% the recommendations. So I'm trying to refrain and be polite, but I'm really jumping and extremely happy. Yeah.
Thank you. Good news on a Saturday morning. Okay. Professor Doiraj, what are your immediate thoughts on that top line introduction from Mark? I think it should be on. Yeah.
I think
Okay.
Okay. So thank you very much for that question. I'm not going to give you a scientific answer. Maybe science comes later. I come from the land of two oldest languages with an ancient philosophy which says the whole world is my family. And nothing has united this whole world other than air pollution. I think I can't think of anything else which has brought together this family. The family is in a crisis and we need to work on it. And this document actually has got everything that is required to address this crisis of air pollution.
Thank you. Okay, I just want to drill down a little bit into some of the findings, but also just a very obvious question. I just want to ask you, I know that you're not a doctor, you're a scientist, but why does air pollution have this effect on cardiovascular system, not just the lungs? We can see why it's the lungs. I'm not asking you to go into the scientific mechanisms, but if you could just, explain a little bit.
I think you're going to, so is this on? Yep. I think you're going to struggle to not get me to go into the scientific mechanisms. I think what's important to say is the understanding on how air pollution affects the cardiovascular system is really changed. It's one of these huge areas of scientific excellence. I mean, we have been aware of the cardiovascular effects of air pollution since the early 1990s when we started to see particulate matter associated with death. But perhaps there is this lack of awareness because we don't understand the science. And I am going to talk about mechanisms because they're important. Because if you want to really believe these associations are real, you need to understand those mechanisms. And we have a good understanding of them. So effectively what happens when air pollution goes into your lungs is your body mounts a defense. It tries to get rid of this air pollution, but it can't do so. So it mounts an inflammatory response that spills over into the blood. So we effectively have the whole body having a sick response to that. There are various other mechanisms involved as well. Some of the things I'd like to highlight, and I think one of the most interesting findings, is some of these particles, they are smaller than viruses. And we don't have any trouble imagining that viruses can get into the blood. These particles do the same. So once they pass from the lungs into the blood, they can be carried to every single organ of the body. Worse than that, they start to preferentially build up in areas of disease, areas where they can cause the most harm. So it's as if almost they're designed to cause the most harm in the body.
And obviously you're talking about a systemic effect, but are there any reasons why the cardiovascular system might be more susceptible to this inflammation that you've talked about?
Well, I think some of the figures we're showing are just really highlight that cardiovascular disease is so prevalent and it's so fatal. So that's why the deaths are so high. But we mustn't lose sight of the ill effects too. There are various different sort of methods, for example, we can explain why they have cardiovascular effects. So as part of my own research, we do acute exposures to volunteers to various air pollutants. And it's really amazing when you see the level of effects they have in the body. So they don't just have one bad effect on the cardiovascular system, they have many. They change the rhythm of the heart, they make it more susceptible to stress, they make our blood vessels stiffer, they increase our blood pressure, they make the blood more likely to clot. All these things build up together. These are mechanisms very similar to smoking, and in some cases quite long-lasting. And I think that's why we're seeing such strong cardiovascular effects.
You've been obviously involved in this in great detail. You've talked about the extent of the problem and the numbers that you find staggering. But were there other things when you're doing the research for the report that you found striking that you didn't expect to find?
I think one of the main things is that we have changing levels of air pollution. So over the years, over the last 10 years, we are seeing strategies come into place. And I think looking at the global figures and seeing the trends to see which countries improve or don't improve, to see the fact that despite some of these policies starting to come into place, we have such small reductions, I think certainly was surprising. We take some reassurance that things are on the improve, but I think we do need to be very, very careful of the inequalities linked to air pollution. Some of the effects and the levels of air pollution are in low and middle income countries which have the least capacity to deal with the ill effects. And those numbers are still quite frightening, no matter how many times you see them.
Professor Dorivash, did you want to come in on that in terms of the countries least able to deal with this or the most affected? How did you see some of the global figures affecting low middle income countries?
Yeah, I think it's really staggering when you look at the low income and low middle income countries, because a large majority of air pollution comes from this. In fact, you showed a data that some countries have more than 10 times the WHO recommendation. I would say it's 20 times. I mean, there are cities which the average is 100, 120. So the biggest problem in these countries is they are the least enabled in terms of tackling this. And therefore, we require a global solution. We require simple, practical solutions in terms of how to reduce this air pollution, both indoor and outdoor. And the other thing that is very important to understand is it's got socioeconomic dimensions. The poor people are affected most. We did a small study in Delhi and showed that within a span of 400 meters, there's a gradient. People are living in high-end apartments have much lower indoor and ambient air pollution as compared to people who are living in the slums. Second, there's a differential between men and women. We have a case study where we gave the husband and wife. The husband is an e-rickshaw driver. An e-rickshaw is something like electronic tuk-tuk. He goes around the city driving. So you would expect that he is exposed to high levels of air pollution. So we gave an air pollution monitor to him with a GPS monitor. Same thing was given to the woman. And when we took that monitor out and analyzed the PM 2.5, it was very revealing. The level to which the man was exposed was 45, and the level to which the woman was exposed was 250. Because she's living in a one-room tenement without any ventilation, using fuel for cooking. And so it was really very high. Obviously, one swallow doesn't make a summer, so we need research evidence on this gender inequities.
Yeah, very interesting, absolutely. Dr. Neer, obviously, you know about this issue very well, but was there anything in what Mark Miller presented that you found striking or unusual that you didn't expect?
More than anything, it was on the recommendations. I think we fully endorse the recommendation, but it's really a great pleasure to see a community like the World Health Summit talking about the issue of the fossil fuels, which is something that we all need as a medical or health professionals at a large, in the broad sense of the health professionals, is very positive to see that now most of a high percentage of these members of this community start to talk about the importance of doing a transition to clean sources of energy. And this is something that a few years ago, very few public health officers will be talking about it. So the pleasure to see that this community, together with the environmental health community, we are going to the COPs, for instance, the climate change negotiation processes, and we are telling the negotiators that it's not just the degrees, Celsius degrees, what they are negotiating. They are negotiating with our health, because more they postpone decisions on accelerating this transition to clean sources of energy, the more they are contributing for us to have high levels of air pollution and therefore cardiovascular diseases, among others. So this is one of the things that positively stimulate me and see that is the big change. The other change is who will be engaging on this, and maybe on a second round of questions, but the role of mayors, I mean, the role we will have for local authorities and municipal authorities on the measures, the interventions that they put in place and how this will be contributing. But the monitoring issues as well. We need to sensitize everyone for having an option to monitor air pollution on their daily life and using that to do more advocacy and putting more pressure in our politicians, policymakers, governments, and moving on that. That's the most positive, but at the same time, new trend that I see.
Thank you. So, Dr. Miller, moving on from that, in terms of cardiologists and cardiovascular scientists and other healthcare professionals getting involved, advocating for this, bringing it to light. Obviously, the World Heart Report is going to make a huge difference. Having this, talking at this meeting, as Dr. Nera says, it is becoming more raised. But how can cardiologists and cardiovascular scientists work together to advocate?
I think that's a great question, and if I could maybe break it down into three parts. I mean, firstly, I think I'd like to see more doctors speaking to their patients about air pollution. Now, actually, from what I'm told from my clinical colleagues, very few patients will come to you and discuss air pollution. But I think this is starting to change now. And if you have someone who has a severe heart disease and you might suspect they have very high levels of exposure to air pollution, be that indoor or outdoor, we are now starting to see documents and guidelines appear where you can incorporate air pollution into a medical history. And of course, I should highlight the World Health Organization has a training kit, an online course specifically for health professionals using a train-the-trainer approach. And it's an excellent module. So I think we're starting to see it in clinical guidelines. Taking that one step up, we need to see more air pollution in medical education as well. This is not just medical students, this needs to be different sectors. So cardiovascular scientists, it needs to be people outside the cardiovascular community. We need more multidisciplinary research. We need to factor in city designers, transport officials. And I think just in relation to the last point in terms of advocacy, the cardiovascular community is a hugely respected voice, not just with patients. There is a great opportunity to have an impact and advocate for starting to put the environmental crisis onto the agenda. And we have these esteemed organizations like the WHO, WHF, the AHA, ESC. This is a way to have an international voice and to make change.
Can I intervene on this one? Because I think it's extremely important. And in WHO, for us, we always put it almost together climate change and air pollution, as you know, because we recognize that there is an overlap on the causes of air pollution and the causes of climate change, which is exactly that, the combustion of fossil fuels. Until now, we were creating a big network of activists, NGOs working on environmental health and climate change. What we have been doing in the last 2 years, and I invite all of you to join formally, is a network now on professional associations. And I think your professional associations, we will benefit enormously if you join us on this network, because now, as you say, the voices of the doctors, even beyond the doctors, that the health professionals working on this are fundamental and very credible, and we need all of you. And just before I forget, next year in March, we are having the second global conference on air pollution and health. It will be announced in a few hours officially by our Director General, so maybe I'm doing something wrong here, but you have a scoop. But this conference is the place where we want to focus on interventions, on solutions, and we need you. We need your communities very strongly represented and giving those messages. It's not only treating the cases, I mean treating the patients, but we need to make sure that when those patients are treated, they are not returning to a place where they will be exposed to very high levels of pollution, like is the case, I'm afraid, in New Delhi, but in many other places around the world, unfortunately.
Yeah, please add your thoughts on that. How can it be done in places like New Delhi?
So I think Mark and you have said a lot, but I just wanted to make 2 or 3 points. One is the role of the health sector in reducing air pollution, which is not talked about much. As they say, physician, heal thyself. I think health systems have to heal themselves. If you look at the greenhouse gas emissions by the health system, it's close to 5% of all the greenhouse gas emissions. And if we put all the hospitals and the health system together, it would be the size of greenhouse emission by a country like France. It's that high. So I think there are very simple practical solutions in terms of waste management, in terms of sustainable procurement, in terms of alterations, structural alterations, and those can bring about major changes. That's number one. Number two is we need to recognize that this is multidisciplinary. We require a real multidisciplinary approach. How do we make low-cost air purifiers? How do we make low-cost masks if required? How do we change the policies? How do we advocate to policymakers? How do we create policy briefs for policymakers? There are several things that we can do. I'm very tempted to end with a quote of a person who was very fond of Geneva, von Goethe, who was the German philosopher but lived in Geneva for some time. He said, knowing is not enough. We must be willing. Willing is not enough. We must act. Even if we act and change half the things that has been presented here, we would have done our duty.
Thank you. Now, you just mentioned masks, and I'm going a bit off-piste here, but I just wanted to think about, these are 2019 figures. With all the mask wearing of COVID, might that have an impact on cardiovascular outcomes linked to air pollution? Or is that too simplistic and I'm not a scientist?
No, not at all. It's a great question, and it's a question we're often asked as well. So the science is still emerging on this. Now, there have been studies, for example, where volunteers have been asked to walk along busy highways, say in Beijing, and they wear face masks, and you do see improvements in cardiovascular parameters. You see improvements in heart rate variability and blood pressure. What we're lacking is a good long-term trial, a randomized controlled trial with long-term wearing of face masks on hard cardiovascular outcomes. It's a challenging thing to fund. It's something that we desperately need to see if this makes a long-term impact. There is a note of caution, though, as well. So face masks, they don't remove all air pollutants. They filter out some of the particles. They don't remove some of the gases. And I know I focused on PM2.5, but let's not forget nitrogen dioxide, sulfur dioxide, ozone. These are all of concerns. Face masks won't improve those as well. The other thing to consider as well is there's slightly different wearing a face mask to protect against air pollution than it is for respiratory viruses. When we look at ultrafine particles, so these are the even smaller particles that are the size of viruses, they don't behave in the same way when they're like a dry particulate. Actually, the material of a face mask is great at removing them, but it's actually the face fit that's most important. And when you're wearing a face mask and you're moving, even if you're just talking, the fit on the face isn't as good. The particles will just go around the mask rather than in them. So there is perhaps a role for face masks, but it certainly should not be the solution. We need to be removing the air pollution, not protecting ourselves against it.
Sure. Okay, thank you. Now remember, there is time for questions, so please, if you do want to ask a question, there's microphones in the aisle. Please do come to the microphone to ask your question. And while people are thinking about that, come to Dr. Meera. I wondered if you could share with us any other successful joint efforts, coordinated actions that have been positive in some of the areas that we've been talking about. What does your department and WHO do currently? Obviously, you've mentioned some of the things already, but is there any other things you wanted to talk about?
Thank you. There is a compendium that we have produced with several interventions that have proved to be very, very effective and useful, and this is the one that we would like to promote. But more than that, as I mentioned before, the work with mayors and local authorities, I think, is more and more fundamental. Those are the ones that can take actions, for instance, on promoting sustainable transport. And again, your role, our role as the medical or the health professional community is very important. I'm sure that you all remember what Mayor Sadiq Khan in London has been doing on the ultra-low emission zones, or what Mayor Hidalgo in Paris is doing. Is incredible, because now 30% of the people living in Paris are using a bicycle in Paris, which is something in few years. So the changes are possible. I think Beijing is another example that we are seeing now, where the pollution levels were absolutely terribly high, and now they are starting to control, or at least putting in place some interventions that are proved to be very effective. We need to go as far as legislation if possible. I think the directive of the European Commission on air quality is another very good example. EPA is now as well putting more restriction. So we need to keep that pressure and make sure that the solutions are coming from legislation, from endorsing the air quality guidelines, from working on sustainable transport policies, and working on energy efficient, working with architects and urban planners, because most of the work we need to do, it will be at the urban, at the city level as well. So we need to be prepared as a medical community to have a language and engagement with other sectors like transport, urban, sustainable food systems, and climate change, of course, that are moving this agenda.
Thank you. And yes,
Okay,
Professor Darraj.
I thought, both of you said a lot. I thought, what are the research gaps that need to be addressed? Number one is, we are talking about PM 2.5, and as rightly pointed out, we are not talking about the other pollutants and their interactions. But we also need to understand that PM 2.5 is very contextual. The constituents vary on the source from which air pollution comes, and we need to actually identify, do the speciation analysis of that. Second, what are the mitigating things that we can do? The third is, what is the interaction of climate change with air pollution? That's an important question that will arise. How does floods, how does heat islands, all those, how do they interact with air pollution? So there are many such questions, and randomized controlled trials on air purifiers in patients with heart failure. We are doing one, for example. So that will give an answer, because heart failure, people with heart failure are the ones who are prone to die within 3 years. I mean, 50% mortality in 3 years. Can we reduce that with an air purifier? Yeah. So those are the kind of questions we need to ask.
Thank you. We have 2 questions, so let's come to our audience. Thank you very much. If you say who you're from, who you represent, that would be great. Sir. Yeah, could you get closer to the microphone? Yeah.
Hello?
That's better,
Yes,
thank you.
I'm here.
Don't be shy.
Okay, great session. I enjoy it, and it's so useful. I live in Argentina in a rural area, so we are thinking all the time in the urban area, not in the countryside. So there is, well, the household pollution is a reality in the most of the houses, but to the burn of the biological waste. So I asked to the panel if it is take in account this burn, that there are some things to do to reduce. This is for the countryside and around the big cities when I live, and it's a problem too.
Thank you. Thank you. So biological waste, the burning of biological waste in countryside areas in Argentina. Who wants to take this on? Yeah.
Because it's contextual, it happens in India, and actually it happens, particularly for me, somebody who stays in Delhi. There is this crop residue burning that happens seasonally every year, and that's a big problem. The only way that can be changed, there are 2 ways you can change, is have some innovation in terms, because why do they burn that waste? Because it's very easy, it's very cheap. So mechanization is going to be expensive, so we need to look at cheaper ways of doing that mechanization. Second is behavior change. And I think it's an important component, because this is a traditional practice which has been happening for years. So we need behavior change communication to do that. If we can do this 2-pronged approach, we would be able to do something about it.
I think his question was as well whether at the global level we take into consideration as well the issue of rural pollution and not only the urban pollution, and the answer is definitely yes. Is the household, and then even last week it was a huge global conference on the clean cooking at the International Agency of Energy with WHO, and there is an issue as well now of wildfires and all of this pollution coming from other areas. So definitely it has to be a holistic view of air pollution, whatever the sources are, and depending on which country you are. So yeah, definitely important.
Okay, Mark,
Can I have
yeah,
one last
quick
go
word,
as
yeah.
well? It's just say air pollution is definitely not an urban issue. There are certain air pollutants which are higher in rural environments. We have ozone. We have the air pollutants that come from agriculture. If you looked in a city and you looked at where some of these air pollutants come, even in a city like Geneva, 20% of it could come from agriculture as well. And that's important. We have some of the strategies to reduce that.
Thank you. Okay, thank you very much. Question from the lady behind.
Thank you so much. My name's Nina Renshaw and I'm from Clean Air Fund. Thank you enormously for World Heart Report this year, putting a focus on air pollution and for opening on this vital topic this morning. So important to hear from the cardiovascular community about how key this is for everything that you're working on. So thank you again. My question is coming from Clean Air Fund. We do an annual report on the state of global funding for clean air, and it's minuscule. I mean, it's less than 1% of development assistance, you will all know this, that goes towards clean air projects. So my question to you is, how can we, your community, our community, work better across sectors to galvanize more funding into air pollution projects? Maria, you will know that WHO gets a huge amount of demand for technical assistance from member states to work on air pollution, which at the moment there aren't the resources to meet. So any ideas for working across sectors and galvanizing more resources for air quality projects?
Thank you for that question. Now, everyone's, after being shy initially, now everyone's coming up and we've only got 2 minutes left for the session. So maybe one person could answer that and then we can take one more question. So.
Definitely, Nina, I fully agree. We need more resources to tackle this huge public health issue. We are now doing an effort of putting and prioritizing climate change and air pollution in our global program of work at WHO. There are many communities, our Common Air and others, that are trying to put it on the political. And definitely, once again, the voice of the health professionals is fundamental.